All right, welcome back. It's time now to check in with Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, always great of you to join us. Good to see you. I know we keep talking about measles, and I'm sounding like a broken record, but that's because it really isn't going away. You wrote on X that it continues to grumble along in Ontario. 4 days ago, on May 22nd, I think there were about 1,800 cases reported here in this province. So why are we not seeing a more aggressive approach from the province in terms of a full-scale campaign or effort to get those who aren't vaccinated protected? We saw it with COVID. There were clinics in schools. There was this mass rollout at community centers.
Yeah, but I think we have to remember that this is not a situation where everybody's at equal risk, right? A lot of this outbreak is concentrated in southwestern Ontario, where the bulk of these efforts are being made. And again, said with no stigma, said with no value judgment, said with no moralization, but the vast majority of this outbreak is among a largely unvaccinated Mennonite community in southwestern Ontario. So, I mean, if we take a step back and look at Ontario as a whole, with about 15 million people living here, most people are totally okay, right? If you're born before 1970, you're presumed to have been infected and recovered from measles, and the risk for infection in that cohort is negligible. If you've received 2 doses of the measles vaccine, this routine, safe childhood immunization, and you're a child or an adolescent, the risk is negligible. And quite frankly, most Ontarians are up to date on the routine childhood immunizations, with the exception of some certain pockets and certain communities. So you're seeing a lot of the efforts really focused in southwestern Ontario, dedicated to the communities impacted, plus, general statements to the province at large, but a lot of the heavy lifting is done in the more heavily impacted areas.
Okay, so it sounds like you're not too concerned with the efforts because it is this pocket in southwestern Ontario. Do you expect that to kind of, stay the same or just slowly increase? What's your prediction for the future of the trend here?
Sadly, this is going to continue to grumble along. This is a very transmissible infection, and I think it's not. We shouldn't be complacent. That's the next point. Is that that's not unique to southwestern Ontario. There's under-vaccinated communities all over the country, and in fact, the resurgence of these vaccine-preventable illnesses is not just a Canadian phenomenon. We're seeing this sadly all over the world. And conversations like this, and local public health outreach, and lowering barriers to vaccinations. And also, fighting misinformation and disinformation propagated online. These are all very important strategies, such that when people are presented with routine childhood immunization, people will say, yeah, that's a great idea. I want to keep my family safe. I want to keep my family protected. And the uptake is higher. So by no means is this a rosy, sunny outlook. I mean, we have to really continue to double down on our efforts to ensure that people have good, solid, sound data so that they can make smart decisions for themselves and their families moving forward. It's not that the job is done and that that this is an easy path ahead. But if we're talking about this particular outbreak, I mean, it's largely, not exclusively, but largely clustered in an unvaccinated community in southwestern Ontario, and that's where a lot of the efforts are focused. But we still need a Canadian strategy and an Ontario strategy to ensure that we can maintain or obtain and then maintain high rates of routine childhood immunizations to prevent outbreaks like this from happening in the first place.
Okay, always good advice and analysis from you, Dr. Bogoch. Unfortunately, we're out of time. I wanted to talk to you about PEP, in-pocket PIP, or joining the CDC HIV infection prevention toolkit, but I guess we'll save that for next time. Have a great morning, and we'll chat again soon. Thanks, Dr. Bogoch.